Good morning, everybody. I'm really pleased to introduce you my PhD topic, which is laser in endodontics. So my name is Mojtaba Dahmardeh. I'm a fourth-year DMD PhD student at Department of Restorative Dentistry and Endodontics. My supervisors are Jolt Lohinai and Eniko Sabo. My SMS is Alex, and my vision is achieving zero failure rate in root canal treatment. And my mission is to find the optimal method for root canal disinfection. So currently we have two ongoing projects. I start with the first one. The title is Investigating the Efficacy and Safety of Lasers in Endodontic Treatment. This is a systematic review and meta-analysis. So more than half of world's population has at least one root canal treatment, and over one-third of root canal treated teeth develop periapical periodontitis, leading to treatment failure. If left untreated, this condition can result in tooth loss and secondary systemic diseases. Standard endodontic chemical irrigants do not completely eliminate all microbiota. Adjunctive laser therapy can help us reduce microbial load and inflammatory symptoms such as pain. Our aim is to determine effectiveness and safety of laser therapy in root canal treatment. So our clinical question is, which adjunctive laser therapy is the most effective in root canal treatment? This would be a network meta-analysis with a population of patients requiring root canal treatment, and intervention and comparators are all type of laser used in endodontic and sodium hypochlorite. Our primary outcome would be effectiveness, microbiologically count by colony forming unit, and radiologically count in periapical index. Our secondary outcome would be post-operative pain measured by visual analog scale. And our hypothesis is that adjunctive laser therapy enhances the efficacy of endodontic treatment, with effectiveness varying by laser type. Our clinical implication is increasing the success rate of endodontic treatment. So here you can see our key articles on 3 different outcomes, and some of our articles have 2 or 3 types of lasers, but mainly they only investigate on 1 type of laser in each article. Regarding the previous meta-analysis, as I said, mostly they have only single laser, but we are considering all type of lasers and we are comparing them to each other, and one of them has no microbial outcome. Our study has 3 outcomes. Here you can see our search key composed of 3 domains, and you can see the hits on 3 different databases. So originally, when we began the study, we had more than 12,000 articles, and after duplicate removal, we reached 9,068, and after title abstract selection, we reached 80, and after finishing full text selection, we have now 72 articles. Here you can see my progress. Currently, I'm at data extraction. So let me start the second topic, which is investigating the effect of endodontic treatment on inflammatory biomarkers. Endodontic infection impact up to 87% of global population. These infections can contribute to systemic inflammation, leading to increased level of inflammatory markers such as high sensitivity C-reactive protein, tumor necrosis factor alpha, and interleukin 6. Elevated hsCRP levels are associated with the higher risk of developing cardiovascular disease. If left untreated, endodontic infections may accelerate the progression of cardiovascular disease. Our aim is to determine the level of serum inflammatory biomarkers before and after endodontic treatment. So our clinical question is that how does endodontic treatment affect the level of inflammatory biomarkers in adults? Our population is adults with endodontic disease. Our intervention and comparator would be blood test before and after endodontic treatment, and our outcome is biomarkers such as high sensitivity C-reactive protein, interleukin-6, and tumor necrosis factor. Our hypothesis is that root canal treatment can effectively reduce level of inflammatory biomarkers. So our clinical implication is to increase awareness of the role of the dentist in the prevention of comorbidities. Our research key composed of 2 domains. Currently, there is no meta-analysis regarding this topic, and you can see the hits on 3 databases. Here you can see our key articles. As you see, all of them have all 3 mentioned biomarkers, and they have a significant reduction after endodontic treatment. So we are at Prospero registration, and I would like to finish my presentation with a quote from Cave Johnson: "Science is not about why, it's about why not." Thank you for your attention.
So congratulations for your well-structured presentation. I have a question regarding your first project. So how many types of lasers are currently used in the endodontic treatment, and which one is the most used nowadays?
So basically what we have right now is almost 4 types of lasers: erbium, chromium, neodymium, photodynamic, and diode. And obviously the diode is the most used because it's cheapest. I mean, that's one of the reasons, but yeah, there are minor differences between each one of them and how they operate, but if I want to answer your question.